pinched nerve in the wrist is the subject of this video. Hi, I'm Dr. Shaki from Irvine Spinal Wellness Center, your Irvine Posture, Movement, and Chiropractic Clinic. Stay tuned. So you have this pinched nerve in your wrist. You're giving yourself a carpal tunnel diagnosis, which is overrated. And of course, the surgical intervention is to go in and take away the retinaculum, this nature's wristband around your wrist, snap it open, and taking away the pain. In reality, it wasn't there just because there was an extra body part in your creation of your body, so they called it retinaculum, put him right there. And it wasn't for the show. It had a function. By taking it away, you take away the function and the purpose it had to begin with. So that's my thought on the surgery aspect of it. There's so much you need to do before you even get there. Number one thing is it really a pinched nerve? Just because you have pain here and it shoots into your hand does not make it a wrist pain or a nerve pain. There are a lot of imposters that we need to think about. And in my practice, I am yet to see, in over 2 decades of being in practice, I'm yet to see an actual carpal tunnel case. They're all from the forearm, all imposed as a result of your lifestyle of typing or using your cell phone. So what we're creating is an imbalance in the forearm muscles, so they're not evenly and in a balanced fashion allowing your wrist to do the movement. In action, when we're working with patients with issues actually related to their shoulders, because your shoulder joint is 100% impacted by the movement of your wrist and your elbows. So it's your wrist, elbow, shoulder blade, and your neck that provide health to your shoulder joint. So wrist becomes, the function of your wrist becomes a huge thing that we assess. So what ends up happening is when we're having a movement that requires wrist movement to relax the hands in certain exercises, patients not able to let go. What they do is they move the rest of their body to put weight over the wrist to get the hand movement. That means when you're going about doing things that require wrist movement, you're using your body parts to give advantage to a fixated wrist. So is it really a true pinched nerve? The chances are very high that it is not. So then what is the fix? The fix is to take away the things that contribute negatively to the lack of movement. So you can't just quit working, you just need to be a smarter version of yourself. Check out the playlist on my YouTube channel that has to do with ergonomics, and make sure that you understand and you actually apply it. There's a checklist on my website. We'll put a link here in the description box so you can self-assess yourself. So that has to do with that. Then the movements that you want to do aren't these things, and the things that probably you can Google, or maybe when you go see your physical therapist or your chiropractor, they have you do them. The problem is not in isolation. I may have a full range of motion in my wrist, but the problem comes from my shoulder blade. Therefore, in action, in true performance, the wrist is compromised as a result of issues here. So how do we fix it? We go and do the exercises that have to do with developmental kinesiology, which is the movement that every baby on this planet does, including yourself. That's because we're wired to do them that way without thinking. Babies don't think, well, what do I need to do next? They automatically do. We're wired that way. So the fix is to go through those movements and see where you lack the issues, and then perform the exercise accordingly. No babies ever know what they're doing. They automatically do, and they never finish the move if they don't have what it takes to get to the end 100% correctly. There's no room to say, oh, well, this is good enough. No, good enough when it comes to functional movement is never good enough. It has to be 100%. So then, am I being a perfectionist? Hell no. I'm just telling you what the answer is, even though you may not like it. Anyway, make sure you check out the resources I put in the description box. If you have any questions, contact me. I'll be more than happy to see what's going on, and make sure you subscribe to the channel. Thanks for watching.